everyone. Today I am going to present evidence-based practice on the topic of altitude training in athletics. Before going to altitude training, we know what is altitude. We already know altitude or distance. Altitude or height is the distance measurement usually in the vertical or up direction. The term altitude is commonly used to mean height above the sea level of the location. There are a level of altitude. Altitude classified into several categories ranging from sea level, it is greater than 500 meters. We have low, moderate, high, extreme. Low means greater than 500 meter. High means low means greater than 500 meter to 2000 meter. Moderate greater than 2000 to 3000 meter. High means greater than 500 and 5000 meter. Then we know about atmospheric pressure changes with altitude. Before knowing this, we need to know what is atmospheric pressure. Atmospheric pressure is a pressure produced by the weight of the air above us pushing down on the Earth's surface. In this, we need to know one more common term: partial pressure of oxygen. Partial pressure of oxygen is extracted by the oxygen in the mixture of gases and represent the delivering force to oxygen diffusion in the bloodstream. Then we know about what atmospheric pressure changes with altitude. When atmospheric pressure decreases, altitude level will be increasing. At sea level, standard atmospheric pressure is 750 mmHg. As altitude increases, barometric pressure falls in the non-linear pattern. Although oxygen concentration remains 20.93%, partial pressure of oxygen will decrease. As reducing in partial pressure of oxygen leading to hypoxia affecting the oxygen delivery. We'll know what is hypoxic. Low oxygen availability in the body caused due to reducing in the atmospheric pressure at high altitude. Then we know physiological response to high altitude. Systems, it is pulmonary, or we know acute exposure and chronic exposure. In pulmonary, acute is hypoxic and increasing in the ventilation and decreasing arterial oxygen saturation. In the chronic exposure, hypoventilation and pulmonary hypertension, increasing in pulmonary lung blood volume, increasing in lung fusion capacity, and high altitude pulmonary edema and reset of altitude residents. We go system. In the system, we will go for cardiovascular. In the cardiovascular, will be increasing heart rate, venous tone, and the cardiac output. In the chronic, we will go decreasing in the systematic and diastolic blood pressure, and right ventricular hypertrophy, and right heart failure, and arterial oxygen, and increasing the plasma triglyceride level and excess of the congenital heart diseases. Next system is hematologic. There will be increasing in the hemoglobin concentration and decreasing in the plasma volume, and increasing erythropoietin and increasing the D-dimeria. In chronic exposure, polycythemia and decreasing in oxygen carrying capacity of the blood. In the renal, it is increasing in the bicarbonate excess and decreasing in plasma, calcium and phosphorus. Hypoglycemic respiratory alkalosis and increasing diarrhea. And in chronic exposure, hyperuremia and microalbumin uremia, decreasing in renal plasma flow, increasing filtration fraction, decreasing in glomerular filtration rate. Then system neuropsychological, decreasing in synthesis of the neurotransmitter, and cerebral vasodilation, and mood changes and decreasing in the cognitive functions, and decreasing in the motor and sensory functions. In chronic cerebral hypoxia, biochemical dysfunction, decreasing in the sleep qualities, increasing the mood disorder and decreasing congenital functions. In exercise, there will be a decreasing in the maximum oxygen consumption and decreasing in the VO2 maximum. In chronic exposure, decreasing in the aerobic exercise capacity. Then we will know about what are the physiological changes at high altitude. In the respiration system, there will be a increasing in ventilation and increasing in respirator and increasing in the tidal volume. Next we will go for hematology. There will be increasing in erythropoietin production and increasing in red blood cells and increasing in hemoglobin concentration and increasing VO2 maximum. In cardiovascular, there will be increasing in heart rate, increasing cardiac output and increasing in mild blood pressure. In the renal, acid-base balance regulation. In the pulmonary circulation, hypoxic pulmonary vasodilation, increasing in pulmonary arterial pressure and risk of the high altitude pulmonary edema. Then we know about acclimatation process. Acclimatation refers to the series of physiological adaptation occurring in response to prolonged exposure to the higher altitude, enabling the body to effect more function effective in the hypoxic environment. It has three mechanisms: immediate, short-term adaptation and long-term adaptation. We will go for immediate. In immediate, there will be increasing in the breath and the heart rate. In the increasing in the breath, first the brain sends low oxygen, so it will signal like you should breathe fast. It resulting in the respiratory rate increases, so that breathing rate will be increasing. In second, heart rate will be increasing. Since oxygen is low, heart pump faster, blood circulation quickly. In this stage, there will be one problem. When we are breathing faster, there will be a reduction of carbon dioxide. Carbon dioxide will be decreased. Blood slightly became alkaline. This is called the respiratory alkaline. Then the second mechanism, short-term adaptation. Here, kidneys start working. When we are breathing fast, there will be a reduction of carbon dioxide. Blood became alkaline. No, then kidney helps to remain bicarbonate from the blood. This brings blood pH value to the normal. Then you can breathe faster without any problem. Next, there will be increasing in the erythropoietin. Erythropoietin is the hormone which is releasing from the kidney. Low oxygen stimulates kidney to release